Good afternoon, everyone. It's a pleasure to be here. My name is Susan Wamithi, and I will describe myself. I have red hair, green dress that has white and yellow flowers. And so today I'm going to be talking about ADHD, and I'll begin. I have slides. All right, so we're going to be talking about unraveling ADHD for us in Sub-Saharan Africa. And I'm a professor at the Aga Khan University Medical College. And one thing I'm very proud about is that I'm a chairperson of the Eastern African Academy of Childhood Disability. And our work is to advocate for children with disabilities, their families. We do research, we do educational sessions, and build capacity for clinicians in the region. And so the reason why I really want to talk about ADHD is because it used to be seen as a social construct. A few years ago, they were like, this is not an African problem. And so, and we have, through research, discovered that it is among us, and we need to figure out how to help these children. And so really it's important for us to understand that for a country, and adult human capital and economic productivity is really dependent on having a stable, steady foundation in childhood. And so for us pediatricians, we're always working with regards to optimizing each child, making sure that they're healthy, and now we are working on making sure that they thrive. And one thing about special needs children is that they have conditions that affect their trajectories in terms of their development. And one thing is that children and youth and young people can have different developmental disorders, but we share the same functional needs. We want to be loved, we want to be included, and we want to participate in our communities. And so let's talk about ADHD. So attention deficit hyperactivity disorder. In medicine, we call it a neurodevelopmental disorder, meaning that we know there's some genetic component to it, and there are some environmental factors that are causing this to happen to children. And having that inattention, having that hyperactivity can bring functional impairments even in the school setting, where the child is unable to settle down, is always running around the classroom, and having issues with academic performance. And for adults, work activities, and unfortunately not keeping up with your work task that leads to unemployment just because your employer unfortunately is firing you because of not meeting the tasks. And one thing that's important is that the impact of ADHD can change over time. Ours is to make sure that we support these young people and the children to be able to function and to be able to monitor their lifelong monitoring and treatment and the things that they need to achieve their developmental potential. And so this is just, I know it's a bit busy, but what I want you to identify is that sometimes ADHD gets missed. About 60 to 80% of children in Sub-Saharan Africa are not diagnosed because we don't recognize the sign. This child is labeled the naughty child, the one who's always at the principal's office, the one who's doing badly, and back in the day, they used to be even in approved schools. And so now that we know it's actually a medical condition, how do we identify these children? And so the inattention symptoms are a child who's not paying attention to tasks. They are having difficulty sustaining attention in school. They're unable to start their homework. So the parent tells me, I have a kiboko there for him to make sure he starts his homework. And there's a child who is unable to follow instructions. As you can see, this can be misunderstood. And a child who has difficulty organizing their tasks, they are unable to keep up with their homework, they're forgetting things in school, and they have a lot of difficulties because of that forgetfulness, that being easily distracted. And so the inattentive children are actually missed out. Because the hyperactive, impulsive ones are very easily identified because it's a child who's causing disruption, the one who can't stay seated in the classroom, running about. They're the ones in the weddings where we're like, who ni mtoto wa nani? You know, and for me, always it's about how do we reduce the stigma for that parent who doesn't know what's going on with their child and being classified as a bad parent who doesn't know how to parent their child. And so this developmental disorder is really important for us to pick up the child who's running excessively, always interrupting adults when they're talking. I hope some of these things are ringing a bell. And blurting out, interrupting, and really intrude into other peers' spaces, causing a lot of peer relationship difficulties. So for us, it's always about how do we identify these children? Sorry, it's not projecting very well. The inattentive subtypes, we have to make sure that all the symptoms that I've listed, do you have 6 out of 9 for children who are under 17? Are you hyperactive and impulsive? And then do you have the combined subtype, meaning you're both inattentive and you're having hyperactivity and impulsive conditions? And always we're asking, is there an impairment? Because most of us can kind of be forgetful, you can be hyperactive. However, you're managing well in school, you're managing well with your peer relationships. So for us, it's always, how is it perfecting a child's function? Are we having poor academic performance? Are we repeating classes? Are you being put in special education just because we're not supporting this child properly? And are we having problems with peer relationships? And so what I want you to note here is the developmental trajectory for these children. Early intervention is important. Making sure that we're not heading towards adulthood without a child being diagnosed, because we run into a lot of problems. And so this is a preschooler who you're being told, oh, he's always disrupting the class, he's running up and down, I don't understand what's going on with him, you go see a doctor. And parents feel embarrassed to come because they're like, he's not sick, but something else is going on. And this is a child who the preschoolers are the ones who are under 6 years of age who can be easily missed. And then the school age begins. Now you can imagine a child who's not paying attention in class, a child who's hyperactive. Your foundation for learning is affected. You're unable to, because there was simple counting 1 to 10, you're busy, your mind was elsewhere. And so these are children who now suffer self-esteem issues because they've been told, oh, this one is always last in class because he's running around, he's a naughty boy. And so we really want to change the narrative of how these children are perceived. And we really work with teachers to be able to identify to help these children. These are children who, because of interrupting others, wanting to be fast, and yet they're supposed to make a line, have a lot of peer relationships, there are fights that happen in school, and they're always being sent to my clinic to solve the problem, and we help guide the parents. And then if that child, of course we have early intervention, if that child is missed, now you're going into adolescent. Risk-taking behaviors of now exploring with drugs, you're smoking, you have risky sexual activities, you're picking up sexual transmitted diseases. And so we really, and they're the ones who are always, the child who you're seeing jumping from two stories, and they're like, why did he jump? Why is he driving carelessly for those who begin to drive? And so we really need to figure out where to help these children. And for the adults, I had the opportunity to be in a clinic where a young adult challenged me when I was a resident training for pediatrics. He was like, where was my pediatrician when I was struggling in school? Now, Dr. you're here I am. I have 5 children with 5 different men, and the pediatrician who I went to see vaccines never caught us. And so this prompted us to do some studies, trying to figure out, for us in the African context in 2015, we're able to pick up that about 6% prevalence of children who even visit accident and emergency units have ADHD. So it's for us as a community to pick up these children, be our neighbor's keeper and say, oh, I think I went to a conference, the inclusive conference, and we're told there's a way we can help these children. Mine is about raising awareness so that we're able to help our neighbors. And adults, like I mentioned before, there's a lot of occupational failure. You imagine if your boss has told you within a week, I'm expecting this project to be done, but you're distracted. You have 10 activities on your desk. Your boss is asking you what is going on. Have you finished this project? You're like, yeah, I started this one, but I thought this one should take priority. So you find a lot of our young adults who are in college are unable to keep up with things just because of the aspect of not being to pay attention. And so for us, how do we help these children? Of course, we have medication for us as doctors. We have cognitive behavior therapy. And now I really want to talk about what assistive technology can do for our young adults with ADHD and our children. And so one of the things is that we talk to parents about environmental interventions. Because they're like, Daktari, yes, thank you for the medicine, but I don't know how to help my child. So how do we structure this child's environment? And so we have really amazing tools. We have audiobooks. So you can imagine a child who's always on the move. How do we get this child to learn? And so for us, it's to adapt the situation. How do we get the audiobooks that are available? And amazing and innovators here have talked to us about the different technologies that we can have. You just give the child headphones and they listen to their homework as they're walking around and running around and you're trying to settle them. And we even have text-to-speech technology where the child, because they have been unable to pay attention, if they're listening and reading at the same time, you find that their attention is better. So that's some of the things technology can do. How do we get speech recognition software where a child can speak into the microphone and actually translate that information? And they pay attention because they like technology. You'll find this child, Other things don't work, but technology is working for the ADHD child. So let's take advantage of making sure that that's available. And the other thing is about timers. So for someone who's inattentive, hyperactive, impulsive, not paying attention, we find ways of getting timers. We have our amazing Android phones, and I think someone from Google told us about the different things that we can do with our phones. And so we can have timers for homework, for their chores, and for their routines. Early mornings are a big hassle for children with ADHD. So we're able to get timers, and they do really well when the alarm goes off. They're like, I know what to do next. Visual reminders, we have them on our phones, calendars, things that can manage projects, reminders, homework, school books. And for those who need white noise in the background, we're able to provide that through technology, because somehow that background music settles them. Somehow that white noise settles them even around bedtime. And so the concerns that we have for us as doctors is that there's a lot of silos that are happening. We have all these assistive technology innovations that we know nothing about. Because the parent is coming to ask us for help, we use the old school things, and now I'm finding out, there's someone in Kenya who's developing this, there's someone who's doing that. And so we don't have this amazing conference, and I thank you, Irene, for inviting us. Now we learn that there's a way that the technology that I'm trying to find for my patient needs to be in a site where I can click away and make that available for my patients. The end users, persons with lived experience, the caregivers who are supporting them. Some of the work we've done is supporting these caregivers in terms of we use Google Meets to do cognitive behavior therapy for parents. And we've been doing that as the academy. So there are so many ways technology can be used. And so how do we bridge these silos? It's collaboration. We've talked a lot about stakeholder engagement, you in the room. All of us working together, government, companies, IT, Google, Microsoft. And for us, it's about priority setting by persons with lived experience. You cannot tell somebody with ADHD what they need. They're the ones to tell us, this is the research that we need, these are the tools that I need, this is the problem I need solved. How do we build capacity for our clinicians who want to learn about technology? You guys have a lot of information to give us, kindly share that. Research. I'm an academic. Research has changed the way we do things in the continent in terms of ADHD. We're now even doing genetics for ADHD for African populations so that we can figure out, we can't just copy and paste what's been done elsewhere. What is the genetics in the African child telling us? Reducing stigma for these tools. Whenever I talk to parents about tools that can be used for technology, they're like, no, he'll stand out. Why does he need this voice to text? Our work is to figure out how do we reduce stigma against technology to help children. And I'm very happy to answer any of the questions. And for us, technology is the solution for ADHD. Thank you. Any questions? Sorry, I think I'm moderating my own session. Yes?
So first of all, thank you so much for that wonderful presentation. I've never sat through an ADHD presentation that made it so simple. Oh, sorry. Sorry about that. Thank you so much for that wonderful presentation. I'm very enlightened from what you've shared, and I'm just curious as to two things. Clearly, I'm sitting here wondering whether I could potentially be having a child who has ADHD, because some of the things you were mentioning from the criteria A are things I'm that parent every time saying, now nitakuchapa, because I'm like, how many times do you keep reminding me about things that you wonder whether it's getting through? Where do people take these tests as parents? And how can we create more awareness, which is where my second question is, particularly using technology, because now we have social media platforms. For example, I work for Meta. I know that when you build communities or share information through Facebook, Instagram, there's more people that are likely to know about them, follow through. Now we have WhatsApp channels where people can really follow information that you're putting out there. Where can one plug into information about where to go for these tests for their children or even for themselves? And how are you using technology right now to create awareness?
So for young children, it's to see a pediatrician, because usually once they screen, they send to us as the subspecialist. And then for adults, it's your psychiatrist or the neurologist. And whenever people hear psychiatrists, they fear, but they're medical doctors. And so we've done a lot of work in terms of using our social media platforms at the East African Academy, because our theme last year was about supporting people with ADHD. And so social media has a lot of, if you just Google ADHD in Africa, social media platforms, family support, we do that for parents. And I love the fact that Google Meet, Zoom, those are avenues for us to create awareness with our educational sessions. So please see your doctor, kindly have your child evaluated. We want them to maximize their potential. So, sorry, I just need someone to help with, yeah, thank you.
Thank you so much for talking about ADHD. My question relates to access to medication. It's more of an area that we need to consider because currently in Kenya there's a huge shortage for certain ADHD medications for adults, and it takes a huge effort to be able to locate where your medication is. By the time you find it, you've got like 20 pharmacies and hospitals and such. So what comes to mind is how do we use technology and how do we integrate technology into the solutions that we are applying to doctors as well as end users to make sure that persons with disabilities and people with ADHD who use medication are able to know where there is medication. I mean, even as we use technology and other behavior changes, but how do we use technology to know, to track where the stocks are, where there's medication, and so that even the government can put in the measures that are needed to reduce the level of lack of medication. Yeah, that's yeah.
So the unfortunate thing is that some of the drug companies have left the market just because of the economy. And so one of the things that we do as doctors is that we actually have a WhatsApp group where we talk about like, where can I find Concerta for my patient? So the first place to ask is your doctor, because we're able to track, because we have ways that we're communicating through WhatsApp. But I love the idea for those innovators out here, how do we track meds? So I'm not a techie, but throwing it out there that we need that tool. Thank you. I think just the last question, and I'm happy to meet anyone after the session. Just one last question.
Okay, that's better. Okay, I was saying my name is Emmanuel Ngurube again. I work with World Vision Zambia, the organization which is child-centered. And I'm just looking at this wonderful presentation and solution through technology to this problem. And these are the things which we detect in some of our child-centered early childhood development programs, which we are implementing in rural Zambia. Actually, also even in most places where World Vision is working, it's usually rural, hard-to-reach places. And I'm wondering the availability of such solution in these rural, and access for those children in rural, geographically excluded, to where development is, and how best we can make sure that this service is available to them. Is there anything we are doing in relation to advocacy with government here in Kenya, something which we can also learn from?
Yes, actually, last year, the MOH launched the rehab strategy and the assistive technology strategy for the country. And so those are supposed to be rolling out into the like in the rural areas, in the primary care facilities. And we even now have teleconsults that we're able to reach and support the pediatrician in that country. And so technology has revolutionized even how we practice medicine since COVID. We can meet you wherever you are, as long as you have access to data. Yeah. And so I'm happy to answer any other questions. I'll be behind after the session. Thank you.